Many people in our state and country have difficulty finding and establishing a relationship with a primary care provider. This is due in large part to the primary care provider shortage, only anticipated to worsen with the implementation of the Patient Protection and Affordable Care Act. Estimates of the future primary care workforce project a shortage of 35,000 to 44,000 adult primary care providers by the year 2025. We already know that more than 52% of primary care physicians no longer take Medicaid, and healthcare reform is likely to provide access for over 30 million more Americans, making the workforce shortage more critical. Nationally, it would take 15,000 practitioners to meet the need for primary care providers at a population to practitioner ratio of 2,000 to 1. Health professional shortage areas are designated by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. These areas are described as having shortages of primary medical care, dental care, or mental health providers, and may be geographic or demographic in nature. As of August 16, 2012, there are 5,721 primary care health professional shortage areas, with more than 54 million people living in them. There is a solution to the primary care provider shortage, and it is in the form of a ready and available resource, a nurse practitioner. Nurse practitioners are registered nurses who complete either a master's or doctorate program of at least 2 years in length before becoming nationally certified. In most states, they are governed by both the Board of Medicine and the Board of Nursing. Nurse practitioners have the education to provide the range of services at the heart of the reform movement, including care coordination, chronic care management, and preventive care. Specifically, nurse practitioners are the advanced practice nurses qualified to provide primary care. There are 180,000 nurse practitioners in the U.S. today. So what are the barriers to using nurse practitioners to ease the primary care shortage? They require physician oversight to diagnose, treat, and prescribe medications. There are also federal laws restricting the ability of nurse practitioners to admit patients to the hospital. How can these barriers be solved? By modernizing and standardizing the scope of practice to allow nurse practitioners independent practice with full prescriptive authority. As of January 2011, 16 states, plus the District of Columbia, have liberalized the scope of practice for nurse practitioners, allowing them to practice and prescribe independently. Research has shown that when comparing the relative efficacy of primary care physicians and nurse practitioners, appropriately trained nurse practitioners produce high-quality outcomes and achieve good health care for patients. Additionally, in examining malpractice trends, the chances of paying a malpractice award in 2006 were 1 in every 62 physicians and 1 in over 1,000 nurse practitioners. In summary, the nurse practitioner role was developed due to a shortage of medical doctors in the mid-1960s, with a vision to help balance rising healthcare costs, increase the number of healthcare providers, and correct the inefficient distribution of healthcare resources. Yet today, in 2012, we continue to fall short in maximizing our utilization of them. We created a solution, and then we handicapped it. Nurse practitioners are a viable, cost-effective, and available resource in addressing the primary care provider shortage. I would ask for consideration of both a standardized and more liberal scope of practice for nurse practitioners in all 50 states.